What Matters Most? All About Me, a presentation by the Penn State Ross and Carroll Meads College of Nursing and Age-Friendly Care PA. This short presentation will address the topic of what matters most to a person living in a nursing home. There are three overarching things that I'd like to talk about today that relate to someone living in a nursing home. Being known as a person, which is what we call all about me. Expressing your healthcare goals and preferences for care. And having others know what you want if you get sicker or can no longer make decisions for yourself. Let's begin with all about me and being known as a person. This is real important that you let your family and the healthcare staff know what is important to you. So let's learn about you, who you are, what is important, what you like, and what you don't like. We have two examples of how you can express this to staff. First, there's a blank form here that's all about me. You put your name, what I like to be called, what your occupation is or was, and important people in your life. And then you can list some of your favorites: movies, books, foods, activities, pets. Put in a quote, maybe, that's a favorite quote. You can put down what you use at home: glasses, hearing aids, dentures, contact lenses, how you like the temperature of your room, things that help you relax or cheer you up, and things that really stress you out, and things that you're proud of, and anything else you want residents with you, staff, family to know about you. And then there's a spot to put photos, things that are important to you, family members, and other things you want the healthcare staff to know about. Here's a second example. It was made by a daughter for her father who was in a nursing home and we had some memory issues. It's called All About Al. So you can know what I'm like on the inside. So it begins with a story about narrative about himself, that he's married, what he did for work, and kind of some of his hobbies at that point. And then he has what he really likes. He likes to play golf. He likes ice cream. He likes people. On the second page is his goals. Like, what are his goals? His goal is to go home, to walk on his own, to use the restroom by himself. And then his challenges. He talked that he does have memory issues. So he wrote down, I have severe cognitive decline, which is really hard to make him communicate. And he goes on about what he likes. He doesn't like fluids or to drink stuff except for maybe orange juice. And in evenings, his memory gets worse. And finally, he knows him best. And then he has pictures of his family. So he can remember his family by looking at the pictures, and people in the nursing home can also relate to his family. Now, let's talk about your priorities for today and your health goals for maybe the next few months. And it's important you let the staff and your healthcare provider know what these goals are. And we're going to begin with health goals. And there's four we're going to talk about: function, mobility, symptoms, life prolongation, and well-being. So let's begin with function. What are your goals for function? For example, do you want to dress yourself without help? Do you want to shower independently? Do you want to be able to eat without help? What are they? What are those goals? And what is the time frame for those functional goals? Next, we're going to talk about mobility and what your goals are for mobility. For example, do you want to increase your strength and mobility? Do you want to get up every day and walk around the hall? Or do you want to do other types of exercise, or just move to a chair or to the dining room for meals? And again, what is the time frame for these mobility goals? Next, we have symptoms. Do you have troubling symptoms that you want addressed? For example, back pain. So if you have back pain, you may not be able to get up and walk around and have you meet your mobility or functional goals. Do you want to get your appetite back so that you gain strength? And do you want to lose the shortness of breath and maybe ankle swelling, because that also impacts your ability to be mobile and to function. So let your healthcare providers and staff know that you have troubling symptoms. Life prolongation. What is something that you really want to live for? For example, to see a grandchild's wedding, or maybe the birth of a great-grandchild. Let us know what that is. And finally, well-being. Think about it and let your care providers and family know what is important to you today, what brings you joy, what do you worry about, what are some goals you have for the next 6 months or maybe before your next birthday. What would make tomorrow a great day? And what else do you want us to know? Finally, we want to know about what are your most important goals if your health situation gets worse. And here we call this advanced care planning. So this is having others know what you want if you get sicker or can no longer make decisions for yourself. And it's called advance directives. There are 3 parts of advance directives: living will, healthcare proxy, and durable power of attorney. Let's talk about a living will. This is specific information about what you would want or not want if or when you become terminally ill. And this can be very, very specific, or it could be just more general of how you'd want to live your life if you were terminally ill. The next is healthcare proxy. And this is a durable power of attorney for healthcare. And this is a legal document. It's appointed by you when you're competent or able to do so. This healthcare proxy makes healthcare decisions for you when you cannot do so for yourself. So you have to confide in this person and let them know, which goes back to the living will, what you want, so they'll understand when they make these decisions for you at that point. The healthcare proxy cannot make financial decisions. So there's another type of person that needs to be appointed, the durable power of attorney. This authorizes a designated person to make financial decisions. So who's going to take care of your finances if you're no longer able to do it for yourself? It would be this person. The durable power of attorney cannot make healthcare decisions, but you can appoint the same person to be your healthcare proxy and the durable power of attorney. So they can make both sets of decisions. But whoever these people are, they need to understand what your goals are and what you want if you can no longer make decisions for yourselves. So let's pull this all together. All about me, expressing my healthcare goals and preferences for care, and letting others know what you want if you get sick or can no longer make decisions for yourself. All these things are so important because then your family, friends, and care providers will know you as a person. Thank you.